Good afternoon, Pat Zemer here today. I want to tell you what I'm going to play today is Elaine made a webinar a week ago, a women's wellness webinar dealing with depression utilizing PEMF and hemp products. And so I want to provide you with a replay of that webinar today. So enjoy it. If you have any questions, just drop them in the chat box and we'll be happy to answer them for you via the chat box during this presentation. So I hope you enjoy, and so let's take a look at the webinar with Elaine dealing with depression and utilizing MagnaWave and hemp products. So enjoy.
Hi, thank you for joining me today. My name is Elaine Pauley, and I'm with MagnaWave PEMF. Today we're going to talk a little bit about depression, specifically for women, but depression of all types. If you're watching this, could you please get to the chat box at the bottom and tell me hi, tell us where you're from. Pat is here with me, and he's going to be helping with questions. You can also go to that chat box and ask any questions that you may have while we're talking. The reason that I decided to do this webinar is because I read a statistic at the World Health Organization that 350 million people around the world suffer from depression, a 20% lifetime rate in the United States. It's also the leading cause of disability in developed countries. So that was really shocking to me because as a mother of 3, I suffered from postpartum depression myself. And I know how badly it can affect your life, your family. And there's a lot of different forms of depression, like postpartum. There's also a lot of functionally depressed people. And you may be one of those people where you go through your day-to-day life. Maybe everybody doesn't see it, but when you get home, you know it, you feel it. Your thoughts aren't happy. It's affecting your sleep, your physical being. With my first child and my second, postpartum depression was something that didn't even come on my radar. My family saw it before I did, but I think the biggest sign for me was my not wanting to take care of my child. Like I just was, and I'm not talking exhaustion. I'm not talking, who wants to change poopy diapers all day? I think everybody gets tired of being thrown up on and getting poopy diapers. It was more of just the not wanting to be there. It was almost a resentment. And it took the realization for me to talk to my family to realize that that's not normal. There wasn't very many options. Drugs were the go-to. Those take 4 to 6 weeks. And I just wasn't very comfortable doing that because I was breastfeeding and I didn't feel like this was a chronic problem for me after. So I started working out. I started eating better. I just went outside and walked, and then I added the MagnaWave to my life. And after a 20-minute treatment, this was about 6 weeks after both children, I felt better. So what I started doing this time with my third child is I out the box started treating my body after my C-section, and we talked about that in another webinar. But I also began treating my head immediately. Day 1 home from the hospital. Every single day I was treating myself. And I have not felt anywhere near the way that I felt with the first 2. So when I read that statistic and I thought about my own journey, I want people to realize that there's other options out there. Now, I'm not a doctor and I don't pretend to be, but I do know that after I have shared my story with potential customers and clients and people like you, other people have begun this journey of fighting their depression with PEMF and MagnaWave, and they have seen similar results. So it's really important for me to talk about this drug-free option. The biggest question that I get is, how do I treat it? A lot of times people want an exact protocol. They want to know 10 minutes on this side, 10 minutes on this side, and treat, the chest or the back. And every single person is different. So what may have worked for me may not be exactly what's going to work for you. So what I recommend doing is starting by placing, this is the Simi machine. And you can use any of our machines to do this. But when you're treating the head area, I recommend starting low, which is a very quick clicking, so very low. I'm going to turn this on so you can hear it. So you can hear the clicking is very quick. There's two signals. There's a low intensity signal and a high intensity signal going on at the same time. So I take this on the low and I do about 10 minutes on this side and about 10 minutes on this side. Sometimes I just use the zoom paddle, which is right here. Sometimes I use the zoom paddle on my head just to switch it up. I also take the large loop and I put it around my neck like a necklace. This is actually sending the magnetic field into my head like a fountain. So if you are uncomfortable with putting it on your head or on a client's head, if they're uncomfortable with it, this is a great way to get those results. Physically, you can move up to a medium or a high as you feel comfortable. But don't start high on your head. You don't want to be uncomfortable at any time. I also treat my entire body pretty regularly just because depression manifests itself very physically. It is a mental issue, but I mean, you have aches, pains, no sleep, and those type of things can really, those wear on you and make the depression even worse. So if you have a question, feel free to ask it. I think we have a question.
Yes, we do. The question is, can you MagnaWave while you're breastfeeding?
Yes. Okay, so absolutely. My supply really struggled to come in this time, so I treated myself, and it was unbelievable. Like, I'm not going to go into descriptions, but my milk supply increased after just one treatment. So if you're breastfeeding and you have a large milk supply, you will have more. And if you're struggling, you can also treat yourself. All it's doing is oxygenating and getting things moving better. So I recommend MagnaWaving specifically if you have mastitis. I had mastitis very bad this time, and the doctor was like, massage it, warm compresses. It's going to take a few days. I went home and treated myself, and I felt it break up within 15 minutes. I mean, it was incredible. So for mastitis, give it a try before letting yourself get sick, because you can get those flu-like symptoms with mastitis. So yes, treat yourself when you are breastfeeding. That's fine. If you don't want to increase your milk supply, I recommend staying on the head and just avoiding this area.
The question is, how do they say MagnaWave helps your depression? What is going on?
Okay, so Harvard did a study, and they actually they did a double-blind sham study, and I'm going to look it up here. So besides the oxygenation of the blood, and hold on, give me 1 second. So it helps with the glucose metabolism of regions of the brain that are involved in depression and anxiety. These regional changes have been mapped in the brain extensively by neuroscientists and have been found by neurofeedback from practitioners to change even with very low signals. So what it is doing is actually changing the feedback from the brain and the metabolism of the regions of the brain. So the stimulation affects the electrical activity of neurons that then change the neuronal network that changes the area of the brain that controls mood. So that's from the Harvard study. So it actually helps change the neuron network of the brain. It stimulates the brain, and in those areas of depression, it really does get things moving better in a very simple term. And it also helps with sleeping and physical changes that really do affect that depression as well. So I am putting that entire Harvard study on my blog that will be published after this. So you can read through that if you would like to read some more. They use a very specific machine for it, But basically what they found is that any level of the gauss that they were using was working. I recommend, like I said, if medium is comfortable for you, treat medium. If low is comfortable for you, treat low. If you have like a max, a Pulse Pro, start at the lowest setting and turn up gradually. You don't ever want to be uncomfortable, but it does get that brain flowing again, get the blood flowing, and really open up those new pathways for the neurons. So, again, I'm not a scientist, but the people at Harvard are, and I also know what I felt when I did it. I want to tell a story of a friend of mine. She came in and called me. Actually, she's a friend of a friend, and her friend called me and said, I'm really worried about my friend. She's very sick, and her depression is so severe that she's a totally different person now. It took me talking to her on the phone about 3 or 4 times to finally get her to come see me and try the machine. About 2 weeks in, she wanted to quit. She has tried everything, and I have what she tried. She did ECT therapy. Hold on. ECT convulsive therapy and TMS, which is high intensity transcranial magnetic stimulation, a little bit different than PMF. And so she had tried both of those, as well as ketamine treatments, where she was taking so much ketamine, she was missing months of her life. So she had tried every drug. She was on between 8 and 10 drugs at the time. So I told her, give me more than 2 weeks. I said, finish the month with me, and we'll see where it is at that point. So she did. She came in every day. She was a very severe case of depression. She was suicidal. She had tried to commit suicide several times. By the end of that month, I could see a huge change in her. She was smiling. She was happy. The hope was there. She sat me down and started crying and said, I have never felt this good. So that was 2.5 years ago. She actually came and spoke at MagnaCon. If you are a certified practitioner of ours and you missed MagnaCon, I will be placing that in the certification training later this week. So you'll be able to watch her entire story and have her tell her entire story. She has a machine now. She treats herself daily, and she hasn't had a suicidal thought in over a year. And this was somebody who was treatment resistant. I mean, she had done everything that she could do. Now, on that note of treatment resistancy, she was on a lot of medication. And if you are depressed or you are getting treated and you are taking medication right now, if you start using this, do not ever cut your medication back without talking to your doctor. She worked with her doctor throughout this entire process and talked to him about what she was doing. And they gradually released her doses to, I think she's on like three pills now. Way cut back what she was doing and taking every day. So he worked with her. So talk to your doctor before you stop taking anything. But it has worked where people have been able to wean themselves off of those medications, which is a very successful event for me. I think that's awesome. So she treats herself daily, and it does not disappear overnight. Okay. So depression is not something that you're going to, I treated myself once and I felt better, but it didn't go away. So, depression is something that if you are depressed, if you're treating somebody who's depressed, buckle down, try to do as much as you can the first couple weeks. So if you could do every day, great. If you could do 2 days a week, great. Get in there, treat yourself. And then also, diet and exercise are huge. I hear a lot of times when I talk to people who come in for treatments that they get told a lot, just go for a walk. That's not going to fix it. Okay. So going for a walk with this and with your medications can help. Look at your entire spectrum of what you're doing, and adding this in can be very beneficial. Do we have any other questions?
Not at this time.
Okay, so I want to tell you a little bit about how I treated my friend. So I did the butterfly loop on her head and the Zoom paddle. We used the Pulse Pro machine. So we started low, and what I found was as I treated her, she was able to take a little bit more. Again, don't ignore the body. She had aches and pains throughout her body, and one of the things we noticed right away, even though her depression wasn't better right away, was her ability to sleep. She was taking medications to sleep, and when I started treating her after the first week or so, she did say she was sleeping better. So that was huge for us. And Okay, when you're treating somebody with depression, I heard a doctor told me this, and it really kind of blew my mind. And what he said was, healing hurts sometimes. Okay, so healing hurts sometimes. And the example he gave was, okay, you get on chemotherapy when you have cancer, you get sicker before you get better. Okay, when you are detoxing your body, you can have things like diarrhea. You can have things where you feel a little bit more aches and pains. A lot of times people take that as the machine isn't working or I'm getting worse. And that is actually the exact opposite. When you're detoxing your body and you're flushing your system and your body is healing, sometimes it hurts and you get those symptoms of diarrhea where your body is flushing everything out. So keep that in mind if you are a practitioner or you're looking for a treatment. Talking to the people that are getting treated with the machine and telling them these things will help you keep them as a client, because they'll look back and say, okay, instead of thinking, oh my gosh, I have this symptom, I'm getting worse, they're going to think, okay, this means the machine is working. So that's really important. Even if you're just treating the head, you can still have some of those symptoms. So keep that in mind when you're talking to somebody. Sometimes detoxing can be painful, and that's actually helping your body heal. And that's a big one for me, because communicating that to the people that we've treated in the office with depression has really changed the game for them, because sometimes they are a little bit more, as they're detoxing themselves, they are a little sicker, or they get a little bit, diarrhea, or they actually go to the restroom more as they flush their body out. Also, lots and lots and lots of water. I can't tell you how much water you should just keep drinking water the entire treatment. Like, here's my water. I drink it constantly. Got my MagnaWave cup. But it's important to drink while you're treating and after you're treating and before you're treating, because when you start detoxing yourself, you need those, what you're detoxing and all of that stuff to flush out of your system. So as you drink that water, it gets it to the stomach and out your body. So always drink water. I also recommend talking to your doctor about getting on a vitamin C treatment or taking taking vitamins. If you aren't already, you need to be on some type of mineral substance, some type of vitamin regimen that works for you. So that's really important. Also, we're going to have Lee join us very shortly, and Lee works with us here at the office. And Lee used, hold on, I'm going to pull it up here. It's called hemp extract oil, and she used hemp extract oil, and with the treatment of the machine, using the machine to help with her depression, and that hemp extract oil really made a difference for her. So she's gonna, there's a lot of complementary therapies that you can use with MagnaWave to help without it being a pharmaceutical thing. So Leah's joining us right now, and she's gonna sit on the couch here with me. Okay, so. Hello. Everybody say hi to Lee. I love her. Anyway, so she started using, you use the oil, or what do you use exactly? Okay, and how much do you take?
Started off at the lowest amount that I could get. Started off at the lowest amount possible at a dropper full.
Okay, so I'll show them the dropper here.
Once a night.
It's got a little dropper with it.
Once a night, about an hour before I went to bed.
Okay.
That kind of took a little bit of getting used to. Worked a little, relieved a little bit of my anxiety, helped a little bit with the sleep. Not as much as I was hoping.
Yeah.
Decided to go up in the milligrams. And
okay.
The highest milligram that they offer, I think, is 1,500.
Yeah.
So I use a dropper full of that every night, and I sleep much better. My anxiety's gone. My depression is gone.
Yeah, and you have a machine too.
I do have a machine
at home,
but I was using this before I got my machine.
Okay.
So now with the combination of both of them, yeah, I sleep way better.
Right.
Off of antidepressant medication altogether. I had been on that for years and years. So
that's awesome.
In fact, the depression runs in my family.
Yeah.
My mom, her mom, me, my sister. Anyway, so now no medication at all.
That's wonderful.
Yay.
So yeah, that's great. So with your anxiety, so when you started taking it at night, it still helped the anxiety the next day? Or do you think the sleeping?
Well, it took a little bit for it to get built up into my system.
Yeah.
Probably a good month, I'd say. And as long as I keep a consistent level in my body, it works well.
That's wonderful. So my husband also has degenerative disc disease. He uses the machine constantly to help with him. And for 9 years, he's been using it. And his back pain is so much better. And the degeneration of the bone has been way, way, way slower than the doctor has ever recommended. But when he would go play outside with our kids, he would come in sometimes and have those aches and pains and have that trouble sleeping. So he also added the hemp extract oil to his daily treatments, or, you know, after he treated before he went to bed. And he doesn't take any pain medication. He's been able to, you know, they told us when he was diagnosed that it would be 2 or 3 years before he had surgery. That was 12 years ago. So there is no surgery, and he's able to take the edge off of his pain with this. So these are 2 alternative therapies that you can use together to get rid of that depression and anxiety. And they work together great without that pharmaceutical compound. And they come in a number of flavors. We have mint and cinnamon. Which one do you take?
I take the mint.
The mint, and you like it?
I do.
So there's mint and there's cinnamon. They come in 250, 500, and 1,500 milligrams. We will have these on MagnaWaving shortly, so that if you're interested in getting them, could you hand me those too? They also come in a gummy. So if you're not into taking the oil, you could get the gummy. I guess they're called gummy drops, hemp extract gummy drops. And these are great. So if you don't like the taste of the oil, every single piece has 25 milligrams. So when we were looking into different hemp companies, Lee actually introduced us to this company. What they told us was a lot of times when you're taking dosage, it's really, really hard to know what you're getting, and is the bottle consistent from the first to the last. All of these are independently tested, and every single one has the exact same amount. So it's serious quality control. You know what you're taking, and you know how to take it. But what I learned about the hemp is it's also varies, just like Lee said. She started at one dose. You started lower, right, and then you worked your way up to higher, and she got to where she needed to be. So there is no magic, take this amount at this time, because everybody's different.
Right.
Yeah,
very much so.
Very much so. So that's something, we will have a dosage guide on there so that you can start somewhere. But again, it's just like the MagnaWave. Start low and see how you feel and work your way up, because you will gradually find that sweet spot that works for you or your practitioner. Do we have any questions?
No questions at this point.
Okay. And then have you ever used this?
No, I haven't.
Okay, so this is a salve, and you can rub it on. It comes in different flavors. This is Autumn Harvest. So this is full spectrum, but you rub this on your body. And what my husband does is when he has back issues or pain in a muscle, he rubs this on his body, and then he puts the large loop directly on it. And it helps with the absorption of the salve. And I don't know how it works. How do it do? I really don't know. But when he puts it on, he feels better. It's like his muscles feel better. So after he works out or runs and does these things that the doctors never thought he was going to be able to do at this age, he's able to just relieve those everyday aches and pains. So whether you have depression or you have aches and pains, just general, hey, I run a lot and my knee hurts, this is a great thing to do along with your treatment. Thank you, Lee.
You're welcome.
I appreciate your story. Okay, so I think, do we have any more questions? Or okay, so as well with the hemp extract, on my blog, I will have all of the links to the medical studies. It is clinically proven to help with depression. So you get all those properties of relaxation and that anxiety without any of that part of the plant. So it is totally grown here in Kentucky, sourced here. Everything is put together here. So this is a Kentucky Proud product, and we are in Louisville, Kentucky. So it was really important for us to support our community. And if you have any questions about the hemp extract, how to use it with your depression, you can ask now, or you can also come on our website. We have a chat feature on MagnaWavePMF.com, and we would be happy to help you there as well. And then I guess the biggest thing to keep in mind is that you can use any of our machines to do this. The Semi machine is exclusive to MagnaWave. So if you have one of these, this is a great place to start with treating your depression. And I recommend, again, treating as often as possible, even with postpartum depression. Don't ever go off any medications until talking to your doctor. But starting this MagnaWave journey for your depression is definitely something I recommend for you and your clients. But I think we're good, and we're going to wrap up. Thank you for watching. Again, if you have any questions, feel free to go on our website and chat in. Lee and I will be there to answer, or check out my blog. It'll be posted later today.
Hey, I hope you enjoyed the program today. It's very interesting listening to Elaine and Lee and watching them share their information. If you got a topic you'd like for us to cover in one of the MagnaWave Wellness webinars, just put it in a chat box here or send us an email at MagnaWave. It's Pat Zemer at MagnaWavePEMF.com and or Elaine at MagnaWavePEMF.com, and we'd be more than happy to address the topics that you'd like to see covered with regard to MagnaWave PEMF and MagnaWaving. So thanks for joining us today. We hope you enjoyed it, and we look forward to being with you later. Have a great day. Bye-bye.